talk about prescriptions that, you've been recommended or you've been prescribed and they don't mix well with your diagnosis.
So Chandra is on Epidiolex, and Epidiolex went through the FDA, I think 4 years ago, maybe 5 years ago. Anyway, Epidiolex is the only FDA-approved medical marijuana.
Yep.
It is the only one that is paid for by insurance. It's called Epidiolex. Because it is medical marijuana and it is not THC, but it's CBD, it relaxes the brain.
Yes.
She cannot take it to school because you're not allowed to have marijuana on the campus.
But there's no THC in it.
There's no THC. Yep. But she can take Rufinol, which is also known as a date rape drug. That can go to school. There are so many narcotics out there that are used for epilepsy.
Yep.
There's Vicompa, there's Sympazan, there is pure Valium. There's a spray, which is one of our rescue meds, and it goes in the nose like Narcan or like Afrin, for those of you who don't know what Narcan is. And because of the meds she gets, we actually get a prescription of Narcan a month, just in case we have to use it because of the meds from the epilepsy. But all of that can go to the school, but not the Epidiolex. That is an oil to soothe the nerves in the brain for the seizures. And the other thing the Epidiolex does is it amplifies some of the medications. So now, instead of her having to take 40 milligrams of something, now she can take 20 milligrams, less side effects. But if she takes the Epidiolex with it, it'll amplify that up to like 30 or 40 milligrams. So sometimes they're 2 hours apart, sometimes they're an hour apart. But depending on your seizure also depends on the med that you get.
Yes.
Depending on your hormone changes every couple years. You start getting more flutters, you start getting more hiccups, you start getting more triggers. And now you got to change medicines.
Correct. I was prescribed methylprednisone in 2018, and methylprednisone is a type of prednisone. Well, one of the side effects is seizures.
We're gonna give you a seizure medication that's gonna cause seizures. Now, we know you only have the blinky ones and the tremor ones, but it's gonna get rid of them.
Yeah.
But it will cause the one that makes your eyes roll up, turn purple, and make you fall on the
Jenny,
floor.
I was on this for 3 days, and in 3 days, I had 7 seizures.
Jesus.